Hi, I'm John Crowley, and I'm going to speak to you tonight about improving intercultural healthcare communication in the radiology setting. In particular, we're going to talk about Russian immigrant patients during an abdominal ultrasound exam. So why is intercultural health communication important? And it's important for several reasons. Probably the most important reason is that it's important that we get quality and accurate information exchanged between the patient and the healthcare provider. And in particular, in the Spokane area, we've seen a huge increase in Russian immigrants over the last 10 years, with an estimated population of about 15,000 in the greater Spokane area. And one interesting fact about improving intercultural healthcare communication is that it's just important for the healthcare provider to understand their own culture, their own biases, just as importantly as it for the healthcare provider to know about the other culture. So our own culture, our own biases really play a huge role in how we perceive the patient and how we respond to the patient in the long run. So we talk about culture as being shared, it's learnt, and it's dynamic. And then communication is a transactional process. It's symbolic, and it can be performed in several different ways. We think of communication as verbal, but there's a lot of other ways to communicate with facial expression and body language and physical touch, things like that. And so the extent of a communication process goes way beyond just hello and goodbye. And then meanings are in people, not in words. And it's important to know and understand the person behind the behavior and what maybe is actually driving that behavior. And just because it's different from our own doesn't mean that it's wrong. So how to be a good communicator? You need to know yourself. Like I said, you need to know your own personal biases, and you need to know what makes you tick, so to speak. And you need to be mindful. You need to be mindful of the other person and of their culture, and respect that individual and respect their opinion and their perceptions. Like I said earlier, just because it's different doesn't mean that it's wrong. And seek commonalities between the two cultures and between you and the patient. And of course, always employ empathy. And especially that's important as a healthcare worker. And we talk about developing communication flexibility. It's being able to read the patient and respond appropriately based on that person's culture, based on that person, where they're at in this point in time in life. And these things the cues are always there, but we always don't read them very well and respond to them appropriately. As I said earlier, we need to understand our own culture, and we tend to have an ethnocentric mindset where we're stuck in our own cultural worldview, and we judge others based on what our culture is. And we need to move into more of an ethno-relative mindset where we're attempting to understand the other person's behavior from his or her cultural frame of mind. So to know your own bias and understand that other cultures are not wrong just because they're different, personally for me has been a huge eye-opener in the communication process with patients. So I'm going to talk about Russian culture in particular tonight, and some of the characteristics that go along with their culture. They believe in greeting with a firm handshake, and eye-to-eye contact is appropriate and welcome. In some cultures, eye-to-eye contact is not. So these are the little cues that we need to know about who we're dealing with and what they like. They're a very demonstrative culture where they like hugs, back slaps, kisses on the cheek, and signs of affection like that. And they tend to stand close to each other when they talk. Their personal space isn't large. It's kind of shrunk, and there's comfort in standing close to others when they're talking to them. In each culture, there's always little taboo things. For instance, in the Russian culture, making the OK sign or putting your thumb through your index finger and middle fingers is considered rude. And then conversely, spitting over your left shoulder 3 times in the Russian culture helps ward off bad luck. So, if you see a Russian spitting over their shoulder, they're not being rude. They're, in their mind, they're warding off the bad spirits. Another interesting point with Russian culture is Fridays and the 13th of every month are real taboo days. And in fact, they don't do anything on these days. There's definitely no weddings or celebrations or birthdays celebrated on those days because of their cultural beliefs on those days. And they don't believe that you should give yellow gifts because the yellow is a sign of disloyalty. So if you want to give a Russian friend a gift, you're better off having it blue because it's more of a sign of friendship. But yellow would be a bad deal. And typically, families live together. 2 and 3 generations will live together and stay close once they're even here in the United States. You need to remember that many of these families have been torn apart by multiple wars over the years, and it's been a process for them just to get to this country. So they tend to stick together once they get here. And how do they deal with illness? They really believe that illness is caused by weather or social experiences such as stress from a living situation or stress from an argument they had with a family member. And so one of the key questions to ask one of these patients is have they experienced a lot of stressors recently? And then let them explain to you what they're thinking, what they thought. They tend to do a lot of research. They like to do their own certain home remedies, and they tend to be very stoic about their pain and their symptoms, and they usually kind of delay before they go in to see and get health care help. And we need to be able to understand that they like to ask questions. They want to know about the disease. They want to know about the treatment. They want to know about the causes. So it's very easy to misinterpret this as them trying to be difficult and perceive that they're just getting in the way of the whole process. But they really have a yearning to know and understand what's going on, and they expect that that's one of their rights and one of your responsibilities as a healthcare provider to give that to them. And the families are very involved with healthcare decisions and in dealing with illnesses. I've included in this slide just several simple Russian phrases that would be helpful. And what I particularly liked about this, and it's reproduced from a periodical called Russian Culture, an initiative of old partners in cultural appropriate care from March of 2006. What I liked about this is that they have the English sentence, and then they have the Russian, what's written in Russian, which obviously I can't read, but then they kind of do the English version of how to pronunciate these words. And I hadn't seen a flyer quite like this, and I thought that was very helpful because, as you know, the Russian language can be very difficult to understand, and I thought this was very helpful. And in the following slides, I'll show you a few video clips that will have the English version of the sentence or phrase on the left, and then the Russian version on the right. And then below it is a little video clip that will sound or say the sentence in Russian for you in case you don't have an interpreter available. So I'll click on this link here, and this will demonstrate. So we have several of these, all of the same thing. All of these phrases are just very common phrases that you would encounter during an abdominal ultrasound exam that are critical. For instance, if they've been fasting, the patients need to be able to take in a deep breath and hold it. We have to sometimes push hard with the probe, and they need to let us know if we're hurting them, things like that. So hopefully all those little video clips or audio clips will be helpful. I hope you have found my PowerPoint tonight helpful, and thank you for your time.